Diphtheria spread fears as global conflict risks deadly outbreaks. Just over 7,000 cases of diphtheria were reported worldwide by the World Health Organization (WHO) in 2016, with 6,245 of those taking place in either Madagascar or India. But in Bangladesh and Yemen alone more than 1,000 cases were reported in the last few months of 2017 by the WHO compared to the WHO's 2016 figures where just 2 cases were reported. Diphtheria, which has the potential to be fatal, is spread by coughs and sneezes. It mainly affects the nose and throat, presenting with symptoms of a thick grey-white coating at the back of the throat, a high temperature and breathing difficulties. During the final few weeks of 2017, more than 800 suspected cases of diphtheria were registered by the World Health Organization among the displaced Rohingya population who had travelled to Bangladesh. Rohingya refugees fled to Bangladesh from Burma, where authorities have been accused of ethnic cleansing by the United States and United Nations. There are believed to be 646,000 Rohingya people in the country living in densely populated camps with little access to clean water and sanitary conditions. A WHO report said, "The current outbreak in Cox's Bazar is evolving rapidly. To date, all suspected cases have occurred among the displaced Rohingya population, who are living in temporary settlements with difficult and crowded conditions." They added, however, spillover into the local population cannot be ruled out. WHO considers the risk at the national level to be moderate and low at the regional and global levels. Meanwhile, in Yemen, the nation has been struck by outbreaks of diphtheria and cholera as conflict in the region threatens the very fabric of the nation and leaves more than 2 million people displaced. More than 1 million cases of cholera have been reported in the country, leaving medical operatives unable to cope as the risk of a diphtheria outbreak rises by the day. Between 5 and 10% of those affected die from complications caused by the illness. The WHO has warned the threat of diphtheria spreading within Yemen is very high at a national level and high at the regional level as the nation struggles to overcome the chaos caused by armed conflict across the state and the unprecedented cholera outbreak that has overwhelmed the health system. They also warn there is a limited supply of diphtheria and antitoxin at the global level and no reagents for laboratory confirmation at the country level. And medical supplies are also in a state of chronic shortage, complicating the delivery of life-saving healthcare in the country.